When is the right time to start potty training?
When your child is between 20 to 30 months of age. If you do it before 20 months of age, children are still a little bit clueless about recognizing their body signals. If you see any videos or methods that say potty train your kid in like 3 days flat, it may work, but there is a good chance it won't. I would never call a 6-month-old baby potty trained, even if they are eliminating in the toilet. Let's give them the tools that they need, be able to eliminate in privacy and with dignity. First step is going to be equipping yourself with the right logistics. Trust me, it's a lot lesser than what you imagine. To start potty training, the first thing you need to do is
Hey everyone, welcome to another episode of the Modern Indian Parent Podcast, a podcast that is redefining parenting in Indian families. I'm Sanchita Daswani, a pediatric nutritionist.
And I'm Rinie Gupta, a pediatric sleep consultant. And every week we bring you episodes to bust some myths and help you own your modern parenting choices, even if Nani and Dadi don't agree with them.
Today's topic is a milestone in our kids' life, but it is a very confusing milestone as well for us parents, which is potty training. And in this episode, we're really going to talk about when is the best time to start. Why should you potty train? What are the techniques? What tools should you use, if any at all? So stay tuned to hear all about it.
Absolutely. I am so excited to talk about my journey of potty training my kid. She's 3.5 years old now, and we started potty training her when she was 2.5. So it's been a year since we potty trained her, but it's been really a very interesting experience because the thing is that I took a very offbeat approach. And to give you some background, as soon as she learned how to sit, which was somewhere around 6 months of age, I already was getting the pressure from the family to start potty training her. Honestly, I gave in to that pressure. I went and got a nice potty seat from Mother Care and I tried to make her sit in it, but she was so tiny and she was so uncomfortable on that hard plastic that she just wouldn't stay on. And I distinctly remember my mom was here with me at that time and she said, you can sing and dance to her, and if she's not doing it, then just put on the TV. And for my 6-month-old baby, we actually put on Coco Melon, and I still remember that
No
song.
way.
Right? You know that song where it's like, when
Yeah.
you get the feeling here down low, it's like
Yeah.
stuck in my head. And we made her watch that when she was 6 months old just to get her to sit on the potty. And in my head, there were like alarms going off and thinking that, why is it like this? Why does my 6-month-old baby need to get exposed to screens to learn how to go into the potty? I think that was my first time I realized that there is something wrong with this timeline that I am being asked to follow, that you should start potty training at 6 months. I think once I had that realization, I just abandoned the idea of potty training at that young an age. And then luckily, a fellow sleep consultant recommended a book to me, and she said that I used this book to potty train my kid. It worked so well, and it will give you all the answers that you need. And I'm going to show you this book right here. This is an absolute jackpot for potty training. It's called the Oh Crap Potty Training Method. It's by Jamie Glowacki. And it's really one of the best sellers across the world because this method is so fast and it tells you exactly when to do it, why you should be potty training, and exactly how to do it. So this episode is dedicated this amazing book and how I use this book and the method to potty train my kid in a week's time. It took 1 week for us. All right, so let's get into this.
I want to know all about this because I didn't read the book. And honestly, when I was figuring out when to potty train or how to start, I felt as confused as I did when I started solids. So honestly, for my kids, I did it very late. I did it at like 3.5, because I just didn't know what to look for when they were ready. So my first question that I want to know is, when is the right time to start potty training?
Right. And I think this is such an important question because, like I said, right, I already got the timeline wrong once when I tried to start too early. And I think in your case, it went a little too late. So I think there has to be a middle sweet spot, right? And according to the author, the middle sweet spot is between when your child is between 20 to 30 months of age. So that is a little over 1.5 years of age, but before they turn 2.5 years old. Why she says that is because if you do it before 20 months of age, children are still a little bit clueless about recognizing their body signals and being able to communicate them clearly. And the thing is that, like, if you do it too early and they're not able to communicate properly, it can actually lead to instances of constipation when they're not able to tell you and then they don't want to go into the diaper either. So then they end up holding it. The problem with waiting until they are too late is because then they get so comfortable with pooping and peeing in the diaper that the idea of the potty seems too scary. Because for a long time in their life, they have only peed and pooped in the diaper. So the 20 to 30-month age group is really good in a sense where they are ready to learn their body signals and they are still like malleable enough to try a different setup with ease. So, but if you think about it, this is still a pretty like open age, right? Like 20 to 30 months. There's so many different things that could be happening within this age group. So then she also gives us some signs of readiness to look out for. And I think this was a very key factor that helped me decide that I wanted to potty train my daughter when she was 2 years, 2 months old. And the signs of readiness were, the first one is they start needing privacy to poop, even when they're pooping in the diaper. I started seeing this with my daughter. Whenever she wanted to poop, she would go to a different room or hide behind the sofa or hide behind the curtain, and she would just want to be in her own space. And that was a sign. I was like, oh my God, I didn't realize that was a sign of readiness for potty training, that your child starts viewing this activity as something that should be done separately and they need privacy for it. The second sign is that they have developed basic communication skills. Are they able to communicate their very basic needs like, when do I want water? When do I want milk? When do I want to be picked up? When I want to go out? So when they're able to communicate very basic needs, that is a sign that they're also able to communicate in a very basic way when they want to pee and when they want to poop. This basic level of communication, as long as that is done, then your child is ready to be able to tell you when they actually want to go to the toilet. And a very interesting readiness like milestone that the author suggests is, if your child can sing the ABCD song, right? Then that is a good way of judging in terms of what their communication skill is at. And if it's there, then they're 100% already ready to tell you when they want to pee and poop. And that typically happens by 2 years of age.
Right. So you're saying these are the two main signs to look out.
Exactly. So the need for privacy as well as being able to communicate basic needs and basic language development.
But I want to clarify in terms of the timing, because I know so many of my clients, they tell me that from 6 months, what they do is they start like training the baby to poo in a way, like they'll dip cotton in water and then like squeeze it on their bum first thing in the morning. So the poo happens. Or what they'll do is from 1 year of age, I think similar to what you were doing at 6 months, is they would just start making them sit in the potty to just get them used to it. So, in terms of the signs of readiness, I get it. But do you need to do anything before to prep them to be ready in a way?
That is such a fantastic question. Potty training, at the end of the day, it's a combination of two things. One is that your child is actually able to eliminate in a toilet or in a potty, right? They're able to poo and able to pee over there. And this is something, sure, if you keep taking your child to the toilet every hour, every half an hour, you and like try to stimulate them, their bum by putting something in it, which I don't think is, advisable, then yes, they are going to be able to poo and pee in the toilet. But the other thing about potty training is the child recognizing their own body signals when they want to pee. And that is something that a 6-month-old, yeah, is so important. A 6-month-old, a 1-year-old, they can't do it yet. Like cognitively, they're not ready to do that yet, right? So I think potty training, like the very interesting thing is that there is a spectrum, right? So the bottom of the spectrum is they are like absolutely clueless. Like it just happens in their diaper, they don't realize it, and then they wait for you to clean them up, right? The second level of awareness is them telling you once they have peed and pooed and then they cry. And so this is something older babies, so that's a second level of awareness that I have peed or I have pooed, I am wet now, I'm dirty now, please change me, okay? So when your child is at that level, I wouldn't call them potty trained. But the next level is when they're able to recognize it while they're doing it. Like, it's like if a child is able to say while they're pooping, they're like, I'm pooping. So that's the next level of awareness, that while they're doing it, they're realizing that their body is eliminating and they're able to communicate that with you. And the last and the final level, which is what we want to work towards, is when they are able to anticipate it, when they're able to say, I have to pee, I have to poo, so that they are then recognizing the feeling that their body gets before they have to eliminate, so that you are able to take them to the toilet, right? So, very reasonably speaking, can a 6 month old do it? So, I would never call a 6 month old baby potty trained, even if they are eliminating in the toilet at regular intervals.
I want to ask you to understand a little bit about the importance of potty training. Of course, for a lot of us, the main thing is we want to get rid of those diapers. But why is it so important to potty train?
See, the thing with the potty training and doing it at the right age, one thing is definitely the diapers part of it. You want to get rid of the diapers, you want to bring them to underwears now. The cleanup is so much easier because then you can just wash them in the bathroom instead of always having to use wipes. But there is a point that the author highlights in this book, and it really struck with me. She said it's a matter of dignity, because for a child, when they're a baby, they're pooping in the diaper, it's okay. But as they grow older, as they start developing their own individual personality, their autonomy, if they're asking for privacy, then that is something they realize must be done separately. So let's give them the tools that they need to be able to eliminate in privacy and with dignity. And I think that was a very interesting point.
I love that. Yeah.
And the other thing she also said is that with potty training, you also have to understand that it's a matter of development. So the muscles that we have that are holding our pee, if we don't train them to hold the pee, then they will never learn. And she even goes to the extent of saying that right muscle development will not happen if you constantly just keep your child in diapers and they know they can just pee anywhere. She uses the word atrophy. She says that muscle can just atrophy. I'm not sure about that. Like, I don't know what's the research behind it, but it's a very interesting point to bring out, that it's actually important for your child's physical development as well, and not just a like milestone in their life.
Okay, got it. So the idea is 20 to 30 months. We are going to start when your child shows those two main signs where they start to want to pee and poo privately, and they've also been able to communicate the basic things of their needs. Now, we understand the importance of it as well for potty training. So I want to understand, how long should potty training take? Is it 2 days? Is it a week? Is it a month?
The potty training duration can really differ on what kind of method you use. The first thing that I want to tell parents is that please don't have unrealistic expectations. If you see any videos or methods that say potty train your kid in like 3 days flat, or potty train your kid this weekend, it may work, but there is a good chance it won't. All right. So, potty training, very realistically speaking, it would take 7 to 10 days for you to make good progress. But that is if you take the right approach as well. If we end up taking like a mixed bag approach, which is, I have seen parents in my circle tell me that, oh, I've been potty training my kid for 2 months now. And I'm just like asking, wait, what do you mean by that? She's like, because, we try to do it for 3 hours in the day, in the evening, when we have her diaper free, so that we're trying to teach her how to understand her body signals during that period. So if you're only able to commit for like 3 hours in the day, then potty training can take a lot longer. But if you head in with a diaper free approach, then 7 to 10 days is a good timeline to aim for.
So is it better to then do a gentle approach, or should you do it one time all in?
It's a matter of personal preference, but also in terms of like what kind of success rate you're looking for. It's something like teaching baby led weaning. If you do it for one meal a day, sure, you will make some progress.
Yeah.
It's going to be a very slow progress in terms of teaching the child how to self feed. The same thing for potty training as well. If you only do it for a small part of the day and you want to do it very gradually, sure, eventually your child will learn how to use the toilet and be diaper free, but it may take you a long time to get there. Personally, I much prefer just ripping off the band-aid and just going with it, because your child is ready, right? So why kind of delay out that process? Might as well just take a week to really dedicate to it and be done with it, right? So that's my personal opinion, but it really differs on family to family how they want to go about it.
Okay. So suppose you're starting to see the signs. What do we do? Is there anything to do to prep them?
One thing that I know can definitely help to expedite their interest in potty is actually bringing them to the toilet with you. And I know this is something some parents are not comfortable with it, but I am perfectly okay with like bringing my child to the toilet with me to show her what is it all about, to kind of take away the mystery or the fear or whatever it is that a child may feel with respect to the toilet. Because you see, the toilet is a very strange thing. To us, it's normal, but for them, it's you're sitting and you flush, and there's a loud sound of the flush, there's water. It can be a sensory overload for children. If they have never seen you use the toilet before, again, they have no idea what's happening inside. So I think just bringing your kid to the toilet could be very helpful. The other thing is that you could start reading to them. Okay, so I'm just going to show you 3 books that I got from my girl, which I felt were really good. I did have a couple of other books as well, but these were the best ones. So there's one called A Potty for Me. This is a really good book because the thing is, the illustrations are huge and it's a very nice story. It opens up, so there's a lot of like tactile, involvement of the child as well, where they can open up the pages and take interest in the book. So that's a really good book to have. The next book that I got was this one, No More Nappies. And this is a great book as well because, again, it does have some like sensory involvement for the child. You can see there is like one scene in which you can literally pull up and pull down the diaper. My daughter has done this so much that she has broken this part of the book. And then the last book that I got was this book called The Potty Party. And this is a song that we actually coupled up with a dance. So we just started doing like potty party, potty party. And we used to sing it together. And she enjoyed it so much that the idea of potty or the word potty was no longer foreign to her. It kind of got added to her vocabulary as well because she was saying the word potty a lot by then. She was quite intrigued by it, and honestly, she was actually eager to learn as well. So that was a great thing. Yeah.
I remember those books. I had a Sesame Street one as well, about Elmo going to the potty. So I think that is a great way for kids to connect and make it relatable for them. Okay, so we're prepping the toddler showing they're ready. Now, where do you even start? Like, what is that first step?
Got it. I think the first step is going to be equipping yourself with the right logistics. And trust me, it's a lot lesser than what you imagine. So the first thing is definitely get books like this. You can have 1, 2, or 3, depending on, how many books you want to have. Then the next thing is choosing the potty seat. And this is where there's so many options in the market. To start off, you have to first decide whether you want to potty train your child with like the baby potty, or do you want to potty train them directly onto the normal toilet. Personally, for me, I do not want to do a 2-step transition where I first teach her how to poo and pee in the baby toilet and then teach her again how to do it on the adult toilet. So we just kind of skipped that step and we went straight to the adult toilet. And to do that, we use this like potty seat adapter, right? So I got this one from Chico, and it's got a nice cushion seat and it just kind of fits because it's got this groove. So it fits onto the normal toilet and she's able to sit very comfortably on it. And to support her legs, we just use like a very tall step stool. Like I've got the one from IKEA. So you just take a tall step stool to support their legs. That's very important. But of course, if you choose to use that baby potty, that's fine as well. I feel that the people who try to go for the baby potty are the ones, either they've got a really big house, so then, they're not able to make it to the normal toilet in time, especially when their child is like at a stage where they give them like a 5-second notice before they just start peeing. I mean, in Singapore, Hong Kong, our apartments are small, so we are never too far from a toilet. The third thing, and this is a very important one that I would ask you to get, is a portable toilet seat adapter. And this is something because once your child is potty trained, they will need to use the toilets outside your house as well. And you can't carry these bulky toilet seats with you everywhere. So you get something like this. I'll just show this what it looks like. So it just folds into quarters. But when you open it up, it becomes a kiddie toilet seat adapter. And you can put it on any toilet seat and it's got these like suction cups. So it keeps it pretty stable. And this has been such a lifesaver because when we go to any mall, anybody else's house where we can find a toilet, but we can't find a kid's seat, then we just carry this with us in our diaper bag, put it up, and super, super comfortable for my child to use the toilet anywhere she goes. So get this, super important purchase. The next thing I would ask you to get are these loose shorts for your child. All right. So during the potty training period, you want to dress them very comfortably. So get rid of any kind of button up onesies or any tight pants or
Yeah,
jeans. You don't want them to be wearing any of that. You want them to wear these loose shorts with a very easy elastic that can come up, come down very easily. Also, the reason why it is loose is that it should not feel snug like a diaper.
got it.
That's the important thing. It should not feel like, oh, they're wearing a diaper, and then once you get that snug feeling, then they just end up eliminating in the shorts itself. So this is very important. I stocked up on like 6 of these during the time that I was potty training my girl, and I'll tell you exactly what stage to use them in. The next thing you need is underwears. All right. So there are many different types of underwears available. I think I just prefer these like boxer shorts kind of underwear, even for kids. There are so many different ones available, but just find the right size. I actually suggest that when you're going underwear shopping for your kid, take them along with you. Let them choose their own pattern, whether they want Spider-Man or a unicorn. Let them choose that pattern because the time comes for them to wear an underwear instead of the diaper, then they'll be much more inclined
They need to
towards
be
it and
excited.
accepting. Yes, they need to be
Yeah,
excited about it. And the last and the final thing that you need are these kind of absorbent sheets. Okay, so there are these dry sheets that are available in the market. So this is a one that has got fabric on one side, but it's got this like very absorbent microfiber cloth on the other side. And I think the middle layer is plastic. Your sofa or your child's bed or wherever is it that you don't want it to get soiled or wet when they are diaper free, then you can cover them up with these kind of dry sheets.
got it.
You can use like simple towels as well, to be honest. But then for me, I just feel like this is more secure because it doesn't let the liquid pass through. And while we are on this note, I'll tell you one thing that you do not need, even if the market, like or Instagram, makes you feel that you need, and those are training pants. Okay. So these are training pants, which is marketed as a potty training tool. And the thing with these training pants is that it has this absorbent layer on the inside that is actually able to hold up to 1p. But this is not something that you need or want during the potty training period, simply because, firstly, they fit very snugly against your child's bottoms. So it actually makes them feel like they're still wearing a diaper. And if they feel they're still wearing a diaper, then they're going to end up peeing and pooping inside this instead of
Yes.
telling you that I want to go pee and poo, please take me to the toilet.
I had the same thing. I bought these for my kids and I realized that in fact it was delaying the whole process because you think it's a transition thing, but actually it's not a transition. I like the idea of the loose shorts. That makes a lot more sense. But I want to ask you that the two things. One is because I know that a lot of people forget about the shorts and they just let their kids like run around naked. So is that okay to do as well?
There are different stages for us to introduce the shorts and introduce the underwear. And we have to do it in stages so that your child, the focus is on learning their own body's cues. Because if you go too fast with training pants or underwears, what you're doing is that you're basically replacing the diaper with these. So there is a way to go about it. So you know what? Let's just get into the method. And we have spoken so much about the timeline, what you need to have. Now, to start potty training, the first thing you need to do is I need you to clear out about a week's worth of your schedule. You start on a weekend, preferably maybe a long weekend, so you can spend a lot of time with your kid in the initial days. And if you have to go to work, then you just tell whoever is the caregiver taking over to continue with the methods because, as we mentioned before, it takes about 7 to 10 days. In the first 3 days, you want your child to be commando. And by commando, I mean bottom free. You can still put your child in a t-shirt or, if you're living in a joint family and it's not okay for your child to be just like bottom naked, you could put them in like a long t-shirt or even a dress. But the key is that you're not covering the bottom area at all. And then that's where the games begin because you need to be around your child, glued to them during those first 3 days. And what's going to end up happening is that, let's say you're playing with your child and suddenly you notice that like they are trickling. They're starting to pee. In that second, you need to quickly pick them up and take them to the toilet or make them sit on the baby toilet and then let them know when the pee pee comes, we pee in the toilet. When the pee pee comes, we pee in the toilet. So in the first 1 or 2 days, you will literally be catching them mid pee or mid poo, even. I have done that too. And you are like running to bring them to the toilet during the time so that they understand that when this elimination is happening, when they are in the I am peeing, I am pooping level of awareness, they realize they need to do it in the toilet. Right? So that's the first step of just getting them to go there, and being focused on your child during this period is so important, because you could look away for some time to be on your phone or to do some work or to be in the kitchen. They will end up finishing up their business during that much time. So this is during the daytime. When they're awake, you have to be with them. Now, when nap comes about, now this is where you can decide whether or not you want to leave the diaper on. And this highly depends on how long your child is napping for. Okay, so let's say if your child is just taking about an hour and a half long nap, and this is me telling you as a sleep consultant, during this period, it's likely that your child only has the tolerance to keep their pee in for 1.5 hours. So you can try to get them to go pee before they go down for a nap, and then they hopefully will stay dry during the nap. And then you wake up, and then they go to the toilet again. But if your child is sleeping for longer than that, and my kid taking about a 2.5 hour long nap at that point, I knew that she wouldn't be able to hold her pee for that long. So then what we did was, for nap time, we did put back the diapers. Of course, for the nighttime as well, but even for naps, we put back the diaper. But then when she woke up from the nap, we removed the diaper. Believe me, on the first 3 days, she was so unhappy about removing the diaper because that was her comfort zone. But we had to keep reinforcing it that you're a big girl now, and you don't need diapers anymore, and you can use the toilet. So we use a lot of praise to encourage her that she doesn't really need a diaper. I'll tell you a very funny trick is when she was putting on the diaper for her nap time, I had to tell her, but you know what? It's only when we are sleeping we use diapers. And you know what? Even mommy does that. And then I actually took a sanitary pad and put it on the underwear. And I showed it to her. Look, mommy has a diaper too when she goes to sleep. And then when you wake up, you don't need it anymore. It was just because she was just having such a hard time accepting the putting on and putting off of the diaper in the first 3 days. So we just kind of helped her feel that like we go through this too. So this was just a helpful little side trick that was there, right? But I think the key thing was really watching them like a hawk and like bringing them like mid pee and mid poo and then reminding them. The other thing that was very helpful in the first 3 days is setting a routine around potty. So instead of following the philosophy of every half an hour, no, don't do. Instead, build a routine. Like for example, when they wake up in the morning, before they sit down for breakfast, after they get up from breakfast, before they sit down for snack time, after they get up from snack time, before nap time. And then you can use different milestones that are already happening in their day and then attach a visit to the potty along with it. Instead of, you just saying, like being stressed
Every
about
30
like,
minutes.
yeah, let's go.
Okay.
It just adds so much pressure.
So make it part of the routine.
Yes, which they're already used to, right? So you just say, we're going to have breakfast. And then, when you go in to take them to wash their hands.
Wash hands. Okay.
Just before that, make them sit in the toilet and make it a
I
part of
remember
their
doing
routine.
I remember doing every 30 minutes and I was like, that's so much pressure. And then what if you you take them, so you're waiting till they pee, but then at the same time you're also taking them?
Yeah, so the thing is, like, they may or may not pee. The idea is to make them sit for a couple of seconds. You could read a book to them during that period just to engage them on the toilet, but you don't have to force them to pee. If they do it, well and good, you praise them, be really happy, like, whoa, you celebrate that. Hey, you peed in the toilet, that's amazing. But if they don't, it's okay. Just pick them up and then go on with your day. And then in the middle of those like milestones, if you catch them, yes, mid pee or poo, then you quickly run, take them to the toilet, and then verbally reinforce that this is supposed to happen in the toilet. And then you just keep practicing that. And you will see that your child will start making that link that they want to also eliminate in the toilet because they're getting so much praise and positive reinforcement for it.
That's the first 3 days. And
then the next step.
7.
Exactly. So the thing is, the first 3 days is that you're entirely at home. You are inside the house, you're not going anywhere because you're completely focused on teaching your child how to follow their body signals because they're naked and everything. In the next block, that's where introducing this loose shorts comes into picture, where no underwear, just loose shorts. And once you get your child to wear these loose shorts, you are still focusing on those milestones, but now you're doing lesser prompting. Now you are letting them tell you a little bit more, that they are able to say simple words, pee, poo. And when they're wearing these like loose shorts, because they don't have that snug feeling, when they want to go, they will actually be able to tell you a lot better, right? The other thing to practice between day 4 and 6 is short outings outside the house. And by short outings, I mean 10, 15 minutes. That's about it. So what you could do is you can bring your child to the toilet and then say, okay, now we're going to go to the park downstairs. And then you bring them downstairs for 15 minutes, 20 minutes at most, and then bring them back up and then make them go use the toilet again. So it's just getting them into the rhythm that, before you go out of the house, we have to pee. And during the time that we are outside the house, you can hold your pee. And then when you come back again, you can get an opportunity to pee again. So this is the essence of day 4, 5, and 6, where you are doing loose shorts, lesser prompting, and very short outings outside the house. And then day 7, 8, and 9, you can introduce underwear, shorts, and then try to aim for slightly longer outings outside of the house. I would highly recommend maybe going to a place that does have toilets as well. So I remember that for my kid, it was day 7 when we did our outing and we went to a restaurant and there was a toilet over there. So we took this toilet seat. So we not only got her exposed to staying outside the house, but when she actually wanted to pee, we could practice using a public toilet. That is such a milestone to be able to use a public toilet for a baby because they've never done that before. And it went really well. So that is something I would recommend. Go to a mall or to a restaurant where the toilets are close by, because believe me, in the beginning, your child's going to give you a 5 or 10 second notice before they start going, right?
And what if like you are at a restaurant and they just start over there? How do you respond to them? Do you have to go back to any of the previous stages, meaning they're not ready?
That is such a fantastic question because accidents are so normal in potty training. They will happen. There is no way to run away from them. And the way we respond to the accident makes the biggest difference in terms of how the child will end up feeling. So very important to never shame them, not saying that like, oh my God, look at what a mess you made. Why didn't you tell me? Sometimes I remember when I was growing up in India, especially, they use the word shame, shame. They will say shame, shame, oh. And I'm just like, if you use words like this, you're going to make your child very conscious and they'll be even more afraid to tell you. So what you could do is that you could use very normal and descriptive terminology to tell them, like, you peed in the seat. Next time, do you want to pee in the toilet? Or sometimes I used to, like, at that point, my child was verbal enough. I used to ask her a question that, like, Sarah, where do we poo? And then she'll be like, in the toilet. I said, yes. Next time, can we try peeing in the toilet instead of the chair? And then she'll be like, okay. So I think it was a combination of acknowledging the situation and then redirecting them and reminding them that there is a better way. So no shaming. On the other hand, I see the problem is that a lot of times we also end up saying, oh, it's okay, darling, it's okay. Like, I think we normalize it so much that the child may end up feeling it is actually okay when it's not okay, right? So we want to be a bit careful in terms of how we handle accidents. Just be calm, describe to them the situation, and then remind them that the next time you can tell us when we want to go. And honestly, during this period, you want to carry a lot of extra clothes with you because accidents are going to happen. You want to carry wipes and kit paper towels so that if you need to clean up outside somewhere as well, you are fully equipped for it.
Yeah. Luckily, it's a transition period, and if you follow it, you stay consistent and you commit, it will hopefully not be such a long thing. I want to ask you a bit about the night, because how do you handle that?
Of course, I think with night potty training, and I remember there was this family that came to me with 18-month-old, and then the mom was telling me that, okay, I have potty trained my kid for the day already, but she's still wearing diapers at night. And I told her that the thing with night potty training is that at night they are sleeping, so their conscious mind is no longer active. So then it comes down physiologically. Are they capable of holding their pee for 11 hours? If their bladder is not capable of doing that, then it is actually unfair to start night potty training at that point. Now, that is where night and day potty training can actually be separated based on your child's physiological readiness. And how do you know if your child is physiologically ready for night potty training? You need to monitor their diaper first thing in the morning. If the diaper is more or less dry, then that child is giving you a sign that actually I am ready to hold my pee through the night and not need that diaper. So that's one way of looking at it. If there is, let's say, it's not like a very full diaper, there is some pee in it, that could still be taken as a good sign because, anyways, with nighttime potty training, which is recommended in this book to be done by latest 3.5 years of age, is that you actually can take them for a middle of the night toilet visit. So you start off by actually waking your child up in the middle of the night, taking them to the toilet in their sleep, let them eliminate, and then bring them and put them back to bed. And then slowly you keep pushing the time that you're bringing them to the toilet at. Like you can start with 11, and then you see, the next day at 11, they haven't had an accident yet. Then you wait for half an hour or 45 minutes more, and slowly you let them go through the night without needing to the toilet. But that might take some time to get there. But the main thing is don't push it before your child is physiologically ready, because then it's just going to end up disturbing their sleep, which, in my opinion, as a sleep consultant, is not necessary.
Yeah, I like that you distinguish the day and the night because in the night they're not really aware of what's happening. And I think that's very confusing for parents because you think that you have to do both at the same time. I think the big sign is that dry diaper in the morning. Then at least you know that okay, they can last a bit longer. For boys, I think their muscles and all down there, like it takes them a bit longer to figure that out. And I know some of my friends tell me that their kids, their sons still have accidents much later, even when they're like 3.5, 4, because I think for them it's just takes their body a bit more time to figure it out.
I think totally bedwetting is still fairly a very normal thing. Again, nothing that we should be making our child feel embarrassed for. It's just physiological, and you just need to wait for longer for those muscles to develop. But I think one thing, as I mentioned earlier, right, that she did mention that if you wait for too long as well, then in a way you're not letting your child's body train itself to actually hold that peak. This is actually a milestone. I'm sort of a little late to the party because, in all honesty, when we read the book last year and we figured out that our child is not ready for night potty training, we didn't read the whole night potty training segment. We just let it go. And we were like, you know what? We will look at it later. And then we forgot about it for a solid year. And now my kid is like, she's 3 years, 3 months old right now. And my husband and I are thinking like, yeah, it's time to start the nighttime pod training. Her diapers are more or less, dry now. So let's now do that. So now that's the next thing that I'm going to be embarking on, night potty training. I'm sure I will love to do another episode on just how that experience went. Yeah, and how to do it. But the key thing that I love about this book is that it's a very no BS approach. It's like a no bullshit approach. You are doing a diaper off, bye bye to the diapers, and teaching your child how to do it and trusting them going through the process. And I think that's why it works so beautifully and so fast for us.
I think the hardest thing for us as parents is being a bit firm and having those boundaries. So even when you're on this journey and you start this 10-day thing, you have to be firm and consistent. Don't bring that diaper back. And I think that's the hardest thing for us. But that's why we have books like this. That's why we do this podcast so that you feel confident that you can make these decisions. And Rinie, thank you for giving us so much insight. Honestly, I feel like I would read the book if I had time, but if you're out there and you want to start potty training, this episode is perfect. And thank you, Rinie, for sharing all those insights on everything you've learned about potty training.
So happy that I got a chance to share this journey, and I hope it benefits lots and lots of confused parents out there, because we both were in their place once upon a time. So thank you so much for tuning in. If you like this episode, please do like and subscribe to our channel and check out all the amazing podcast episodes that we have put out to equip yourself as a modern Indian parent.
See you all next time.